Hey everyone, Dr. Jamie here again. And as I said in my last video on iatrophobia, this is the fear of doctors or medical treatment. It can range from mild anxiety to full-blown panic attacks and often prevents people from seeking necessary care. Overcoming iatrophobia typically involves a combination of psychological strategies, lifestyle support, and sometimes even professional intervention. And as a matter of fact, I would say most of the time. So I want to share with you some effective steps for overcoming iatrophobia. For one, it's important to understand the fear. Explore the root cause of it. Was it a traumatic medical experience or a traumatic experience that you had by someone who was a doctor, for instance? Was it fear of bad news or lack of control? Try to pinpoint that cause so that you can better process that event or events. And try some journaling or talking about your experiences, which can help you to identify specific triggers as well. The second thing, cognitive behavioral therapy. CBT is the most evidence-based treatment for phobias. It helps you to reframe irrational thoughts and gradually reduce fear and build coping skills. A therapist can help you to desensitize um, or help you to desensitize yourself to your fears step by step. So, like, in other words, looking at medical pictures or visiting a clinic without getting any treatment. Number three, exposure therapy or systematic desensitization. This is gradual exposure to fear in controlled steps. So, like, you start by reading about doctors and then watching medical news or medical shows, TV shows. Then you visit a doctor's office and just sit there in the waiting room. Eventually, you attend a checkup. Each of these steps builds tolerance and reduces the fear response over time. However, I don't recommend that you ever do exposure therapy by yourself. Only do it with a therapist or a friend or loved one accompanying you, someone that you trust. Number four, therapeutic alliance or medical alliance. I don't know. Find a doctor that you trust. And that's not always easy, but preferably someone who's empathetic and patient. Request longer appointment times and speak with the office in advance about your anxiety. If they're not helpful or they're not listening to you, then you may want to find another doctor. However, make sure that your perception of their reactions is not based in irrational thinking on your part. Also, bring a support person to appointments because that could also definitely help to ease fears. Number five, relaxation techniques. And of course, I talk about this all the time. Practice breathing exercises, progressive muscle relaxation, or guided imagery before a medical appointment or even during the medical appointments. And even like apps like Calm or Headspace can also help you to build these skills on a daily basis. Number six, medication when necessary. For severe phobia, a doctor or psychiatrist might prescribe like an anti-anxiety medication, like a benzodiazepine, for short-term relief before appointments. That being said, I'm not a big proponent of medication in general, especially psychotropic medications, but that's me. I mean, it's based on personal preference as well as professional experience, but phobias can be treated without it. Ultimately, though, that would be your choice and between you and your doctor. No judgment here. Uh, Anyhow, so number seven, psychoeducation. Learning more about how medical procedures work, what to expect, and how rare serious outcomes are can really ease fears based on misinformation or uncertainty. Also, understanding every specific, like step of your specific procedure, that can definitely help too. All right, number eight, participating in support groups. Talking with other people who have iatrophobia or general health anxiety helps normalize your experience and find shared solutions. Although for a specific phobia like this, it might be difficult to find one in your area. But online forums, therapy groups, or Reddit communities can be a start. Number 9, create a personal plan. So schedule regular check-ins with a supportive doctor or therapist. Although I will say that most people with iatrophobia don't have the same fear of therapists that they do of other medical procedures and doctors. Um, when you do have a doctor's appointment, use written scripts or checklists to stay focused during your visits. And always, always, always reward yourself, guys, afterward with something positive to reinforce your success. Remember, while iatrophobia can be extremely intense, ultimately, you really need to look at and understand the negative ramifications that you're going to experience if you don't get treatment. It might be having an unwanted pregnancy because you can't make yourself have a vasectomy. Or you might have cancer or a stroke or heart disease or diabetes or who knows what. It could result in your death. And no, your fear is not worth your life, no matter how much you convince yourself of that. Yeah, people actually do that. And if that's your thinking, then you know what? Tell yourself, fine, I'm gonna die anyway, so might as well go do the procedure. Like then you're at least gonna know whether you're actually telling yourself the truth or not. I know it sounds intense and maybe even a bit obnoxious, but it's realistic. So embrace your fear, go get checked, and keep yourself healthy. I hope that this was really helpful to you. And again, please subscribe and comment below on your experiences with iatrophobia or anxiety or fear because you help others with your comments. Take care, everyone, and I hope that you have a beautiful and safe day. Bye bye.